In today's video, we're going over 4 modifications for low back pain during the deadlift. So deadlifts can actually be a phenomenal rehabilitation exercise for low back pain. Trouble is, if your back is killing you, of course you're not going to load heavy deadlifts. So you have a patient that wants to get back to deadlifting. I want to try to allow them to do that because if we pick the right exercise variation, if we can modify appropriately, we still work towards their strength and fitness goals, but we also simultaneously rehabilitate that injury. Generally speaking, in folks that have low back pain, they tend not to tolerate heavy loads. However, if we reduce the loads somewhat, oftentimes and get away with deadlifting, it feels very tolerable. Now, there's a couple ways to do that. For one, if your athlete is supposed to do, let's say, a 3-rep max that day, but they're not tolerating anything above 80%, we can actually drop the loads down and do higher reps. It's more like 10, 12, 15 reps. It may not be exactly what you want to do, but it is a way to continue training, right? The other thing you can do is you can slow down your reps a little bit, right? So you can add a tempo. We're going to do a 40-second set, which essentially is 2 seconds on the way down, 2 seconds back up again, 10 total repetitions, right? So what we're going to do is have Courtney perform a deadlift while looking at a stopwatch. I'd rather have the stopwatch a little bit higher so you can see it, right? And the concentric going up should be 2 seconds. Go ahead and lift. And then the eccentric going down is also 2 seconds, right? Following the clock as you go. And when you're through 40 total seconds, that's 10 total repetitions, right? What's nice about these slow reps is that you can't load them very heavily. So you get a really good training effect, right? And you don't aggravate the back in the process. We can also change the implement that you're using to decrease lower back pain while deadlifting. This is a trap bar. The reason why the trap bar is pretty nice is because when you go into your setup position, go ahead and get down there for me, Courtney. Bring those knees forward towards me a little bit. So typically in a barbell deadlift, the bar has to pass the knee, so you have to send the knees back to get the barbell to pass. In the trap bar, we can allow the knees to come forward. When the knees come forward, it reduces a little bit of stress on the spine and the hip and makes the knee and the quad do a little bit more work, right? So if the back is not handling barbell deadlifts, we can try trap bar deadlifts to see if they help. Just do 1 or 2 reps for me. And I want you to appreciate the knees coming forward with Courtney at the bottom part of the deadlift. It's generally a little bit nicer on the spine. The next thing we can try is to modify the height that you're pulling from. So let's say a rack pull using the high handles and a trap bar, right? Or you can actually add some sort of lift like blocks like we have here. And one of the reasons why this is a little bit nicer on the spine is probably because we don't have to go quite as deep and it limits the amount of flexion in the bottom of a deadlift. Now, naturally, there's going to be lumbar spine flexion in the bottom of the deadlift, but if you have a lot of low back pain and your back doesn't like flexion, then elevating the surface is sometimes a really nice variation to try. So we're going to have Courtney do a few repetitions here. Staying nice and upright, knees and coming forward, right? And stand up. So this is actually a little bit nicer on the spine than going all the way to the floor, so I recommend you give it a shot with your patients that have low back pain. So let's say you have an athlete that's really not tolerating any variation of deadlifting. The barbell hip thrust is actually a really nice alternate. The reason being is you're working almost the same exact musculature when you do a barbell hip thrust as in a trap bar deadlift and a barbell deadlift, but generally feels a whole heck of a lot better on the spine, right? So again, deadlift's not working. Last decision would be trying a barbell hip thrust. So we're gonna have Courtney sit up here. She has a box behind her, has a pad that goes around the barbell. Very good. Let's have perform a few repetitions. And this resisted hip extension, great for training the low back musculature, great for the glutes, great for the hamstrings. If you found this video useful and you want to learn more about how to diagnose and treat low back pain in weightlifters, I made a video for you. I want you to go ahead and check on that, click on it, get to learning. Thank you very much for joining us today. We'll see you on the next one.